In normal conditions, it shouldn't be painful at all. When patients ask me about how the transfer is, I usually tell them that it's going to be like having a normal pap smear, and therefore the only thing that can be uncomfortable is the use of the speculum, because we need to check to see the cervix. Okay, obviously the first thing that you need to do is to decide the size of the speculum based on each patient, and we can work with the vaginal speculums that are really thin and very comfortable, and in some other cases we may need longer or thicker speculums to get a really good view of the cervix. The inserting the catheter, well, the catheter is really thin, so it's going to be like 0.5 millimeter, and placing it inside, unless there is something wrong with the cervix, either because the patient has had a surgery or there has been some kind of abnormality or disease or something like that, it should be very easy. Using the ultrasound, we can, the nurse guides the doctor, and we know exactly how we have to proceed to get into the cervix. It's true that sometimes there are cervix look like roller coasters, because you have to go first down, then up, and it could be really tricky to get into that. Well, there are different things that you can do to try to make it easier, like for example, working with a full bladder, because if you full the bladder is going to push back the uterus, and sometimes in cases especially in which there is a really difficult angle between the cervix and the body, if you push back the body, the angle is going to be much easier, and the transfer as well. So knowing your patient and making the decisions before the transfer should make it easy and absolutely painless in the majority of the cases.